You know that feeling, right? You get an injury, a sprained ankle, maybe a torn ligament, and it just drags on and on. It's slow, it's frustrating, and you feel like you never quite get back to 100%. Well, what if there was a way to basically supercharge our body's own healing system? Today, we're going to dive into a pretty cool high-tech treatment that promises to do exactly that. And to get a sense of why this matters, let's start with a massive number. According to the World Health Organization, 1.71 billion people around the world have musculoskeletal issues. A huge piece of that pie is injuries to ligaments and tendons. We're not talking about a small problem here. This is a gigantic global health issue. And here's what's so maddening about them. When you injure a tendon or a ligament, the healing process is just painfully slow. The scar tissue your body creates, it's often weaker, it's less organized than the original stuff. Seriously, it can take years for it to get back to being fully functional, which leaves you way more likely to get hurt all over again. So this is the big question scientists are tackling. Is there a way to jump in, to not just sit back and wait for the body to do its thing, but to actually speed up the whole process and, build better, stronger tissue in the end? And that leads us right to our main topic, hyperbaric oxygen therapy, or what most people call HBOT. The theory behind it is actually pretty straightforward, but the potential is, well, it's huge. So what in the world is it? Put simply, HBOT is a treatment where you go inside a special chamber and you breathe 100% pure oxygen, all while the pressure inside that chamber is increased. Let's put that in perspective. The normal air we're all breathing right now is about 21% oxygen at 1 atmosphere of pressure. Now look at the HBOT side. You're breathing 100% pure oxygen at up to almost 3 times the normal pressure. That is a massive change. Okay, so why do this? Well, here's the magic. That combo of pure O2 and high pressure forces way more oxygen to dissolve directly into your blood plasma. It basically turns your bloodstream into an express delivery service, flooding those injured, oxygen-starved tissues with a superdose of the fuel they desperately need to rebuild and repair themselves way faster. It's an awesome theory, for sure, but does it actually hold up in the real world? To figure that out, we've got to look at how scientists really put these kinds of claims to the test. The gold standard for figuring this stuff out is something called a systematic review. This isn't just about grabbing 1 or 2 studies that look good. Nope. This is a super rigorous process where researchers hunt down all the best available research on a topic and then analyze it all together. And believe me, they cast a wide net. They started with a pool of over 2,500 different articles from 6 of the biggest scientific databases out there. They wanted to make sure they didn't miss a thing. And then the real work began. They had to start filtering. They got rid of hundreds of duplicates, then tossed out over 1,000 articles that weren't relevant, and then hundreds more that just didn't have the right kind of data. It's all about isolating only the absolute best, highest quality research. So after all that sifting, all that sorting, from over 2,500 studies, how many made the final cut? Just 13. That number alone tells you how incredibly selective this whole process was. They were only looking at the best of the best. All right, so the moment of truth. After all that work, what did those final 13 studies actually tell us about hyperbaric oxygen therapy? Well, the results were really encouraging. Across the board, HBOT seemed to help enhance collagen production. That's the key building block for our tissues. It sped up early recovery, helping injuries get stronger faster. It was even shown to help reduce the risk of graft rejection after big surgeries, like an ACL reconstruction, and it generally improved how well muscles and tendons healed. The authors of the review really summed it up best themselves. They said, and I'm quoting here, "The findings suggest that HBOT, whether used alone or as a complementary treatment, enhanced healing compared to controls." Pretty clear, right? So the evidence definitely looks promising. But what does this all mean for us right now? Let's get a balanced perspective on where HBOT stands today and what the future could look like. The big question then, is this some kind of miracle cure? Should every single person who sprains an ankle be rushing out to find an HBOT chamber? Well, as with most things in science, it's a little more complicated than that. Here's the situation as it is right now. In the pros column, we know it creates a better healing environment, it's a safe and non-invasive treatment, and it helps with recovery after surgery. But, and this is a big but, in the limitations column, a lot of the best evidence we have is still from animal studies. Plus, there's no standardized recipe for treatment, and we just flat out need more big studies on humans. And those limitations are the biggest hurdles right now. What works perfectly in a lab rat doesn't always translate one-to-one for people. And without a standard protocol, doctors don't have a clear playbook. How much pressure, for how long, how many sessions, for all the different injuries out there. There's no one-size-fits-all just yet. But the potential is absolutely there. The science shows this therapy can kickstart a really powerful healing response. So the real question now is, can researchers get over these hurdles? Can they figure out those standardized protocols and turn HBOT into a go-to everyday treatment for that torn ligament or that sprain that just won't heal? Well, only more research is going to tell us that.